Hi guys, Dr. Luster here, and today I want to continue our conversation on insulin. So we have given an overview of what insulin looks like in the past. I'm going to give a very quick overview of what it looks like in general and what blood sugar, the traditional pathway of blood sugar, because I want you to understand how this is working before we start talking about the medication. Okay, so blood sugar, you eat food, and now all of that is broken down into glucose, which is your blood sugar. That is spiking in your bloodstream, and your body is saying, hey, we have food in here, we can utilize these. All of your cells in your body utilize glucose, so they're very excited that there's food on the table. So all of these receptors are saying, hey, tell the pancreas that to release insulin because there's food on the table. So pancreas releases insulin, and insulin says, hey everybody, rings that dinner bell, it's time to eat. And cells come out, they pick up the food that until they're hungry, they eat until they're full, and once they're done, insulin's like, cool, no more food on the table, my job is done, and it goes away. Glucagon comes out, and glucagon eventually says, all right guys, it's time to find some food again so we can put food on the table. So glucagon and insulin are a little bit of a seesaw back and forth. Okay. So if you've eaten and now you have a lot of blood sugar, so we're talking specifically excess blood sugar. So you've eaten, you have all of this blood sugar, and your cells are full. Okay, so you have eaten entirely too much food for your cells to eat anymore. Your body is saying, it has all of these receptors that are saying, hey, there is still food on the table. You need to tell the pancreas to send out more insulin because there is a problem. There's still too much food on the table. So insulin's like, dude, I already got people out there ringing this dinner bell, but nobody's listening to me. And the cells are like, hey, I'm full. I don't need to eat any more food. Like, I can't fit any more inside of me. So I'm going to ignore this dinner bell. I'm going to ignore insulin. So your brain is still saying, but like, hey, there's all of these receptors that are telling me that there's still blood sugar everywhere. There's food all over this table. I don't care what you got to do, pancreas. Deal with this because we can't have this much sugar in the bloodstream. So pancreas is like, all right, I'm going to send out more people, make this louder. And so your pancreas sends out more insulin, and as it does, the message gets louder, the dinner bell rings louder, but that doesn't, just because it's louder doesn't make me as a cell more hungry, so I'm just going to ignore it, right? So that's what we see when we see insulin resistance. So insulin resistance becomes a really, really, really big problem for a lot of reasons. So the first is that now we have all of this blood sugar that stays in the bloodstream because all of the cells are full. So this blood sugar stays high, and that we talked about how it's related to cholesterol and kidneys in the past. So all of that blood sugar is staying high. It's running out of room in this little cell. So we're starting to see a pressure disperse, where like when you get in a bathtub and the water lifts, it's like a water disbursement because of the amount of pressure differences. So we start seeing that there is extra pressure on the inside of the vessel, and this creates high blood pressure. Meanwhile, all of these, they're running out of room, all of these little pieces of sugar that are floating around in your bloodstream, and these pieces of sugar are super sharp. So they're going through and they're scraping the sides of your very soft vessels, and then cholesterol has to come in and it tries to bandage those things, but it doesn't have time to dry, and so it keeps getting scraped, where the bandage keeps getting scraped over and over again, and cholesterol is just like, I'm just keep trying to put a band-aid on this spot, but it keeps coming off, and so eventually it's got like this pile of band-aids, and it's taking up all of this room in this vessel, and this is what plaque looks like. So cholesterol is actually the good guy in this situation, and it's trying to bandage the vessels that are getting damaged because of too much sharp, spiky blood sugar in the bloodstream. So all of the sharp, spiky blood sugar is causing high cholesterol, and then it's causing high blood pressure, and now all of that is going and pressing up on your kidneys. So your kidneys they filter out your bloodstream, and from it they take all of these toxins and any extra water, and they keep the water balance happening appropriately in your body, and really anything else, and they take it out and they make your urine out of it. The one thing that they don't want to take out is energy, right? You never want to just pee out sugar because you need it. Your body runs off of that. You also don't want to pee out proteins because your body really needs those too. So the filter is small enough that it will let out like water and some waste products and whatnot, but it won't let out sugar. Well, the more sugar that you have in your bloodstream, remember they're super spiky and sharp, they're pressing on this filter and it's tearing up the filter because there's just like this increased pressure coming from all of the high blood pressure of all of the sugar that's in there, and it keeps pushing on this tiny little filter, and eventually holes are poked in this filter. It's starting to tear up, so glucose ends up getting out. And now you see glucose in your urine, and this is not a good sign. Clearly there's too much glucose happening and we're losing fuel. Not great. So it is, and eventually if this continues to be a problem, then the holes keep getting bigger and bigger, and eventually now we're letting proteins out. Now your body can't regulate, and whatever you put in is going out, and now we have kidney failure, and you have to have something to help filter your blood. So this is a huge problem, and it started with just high blood sugar. Both cholesterol and kidney problems started with the high blood sugar. So when we talk about insulin medication, I really want to emphasize the importance of, I guess, how dysfunctional the thought process is with this. So if insulin is not being listened to, right? The dinner bell is being rung by the pancreas, like, yeah, I got it. We need to put out more insulin and try and make this message louder because the cells aren't listening, but that's not going to make them listen. So why would we put out more? Why would we inject more insulin to make that message louder if they're still going to ignore it? That doesn't really fix a problem. It might put a band-aid on a problem. Now, I'm going to put a caveat that this is not applied to type 1 diabetics who are born this way because they have a problem with actually producing insulin. So this applies to type 2 and type 2 that are insulin dependent, that have a high blood sugar problem that led to this, okay? So the idea of putting in insulin to create more insulin resistance, to try and make that message louder, doesn't fix the problem. In fact, it makes the problem worse, because if you are now telling the brain, like the brain is telling the pancreas, hey, you got to send out more insulin, and the pancreas is like, dude, I'm sending out all the troops I got nothing else. What else do you want from me? And the brain's saying, like, I don't know, do your job, tell these people to like take up food. And the pancreas is like, I give up. So eventually the pancreas is no longer going to produce insulin. And this is when you actually are dependent on the insulin that is being injected into you. And you still didn't fix the problem. You just have to keep raising your meds over and over and over again, but you actually don't see that the insulin situation, that the blood sugar management gets better because we didn't fix the problem. We're just trying to make it like having a yelling contest, and it's ridiculous. So I want to give you an example to help manage this. But I also want to add that the other way that traditional medicine goes about this is to have you pee it out. Now, this is kind of a crazy notion too, because we just talked about how it tears up your kidneys, and that's not necessarily any better. So we don't want to just tear holes and everything. So we don't want you to just pee out sugar. Not a great plan. So I see a lot of people in my practice who are actually on multiple insulin medications, or their numbers for the injections that they're using are sky high, and it's not fixing anything. And it's because it all comes back to that we have to fix the blood sugar. So in another video, I'm going to talk to you a little bit about dietary stuff, how we manage this, whether or not you should be fasting, how does that look if you're a diabetic, is it safe, all of those things. But in the meantime, that's a huge overview, and it's very complex, and I want it to challenge how you think about insulin. Thanks, guys.